Because Presley had been limping a bit recently, I took him to meet with Dr. William Strickland, Rose City's resident pet chiropractor. I was curious. I mean, I know all about chiropractic care for humans, but for our most pampered pets too? You've got to be kidding, right? I have to admit, I was a bit skeptical. I wanted to know more about the doctor and actually experience a pet chiropractic session.
Does someone have to go into general chiropractic care for humans before they segue into animal chiropractic care?
Yes, you have to be a licensed chiropractor. And as of yet, in all of the states, there is no actual license credential for working on animals separately. So you must first be a licensed chiropractor.
Now, what would you say to someone who might be a little bit leery about chiropractic care for their pet? Like, oh, you know, I don't know if that's really worthwhile. What would the benefit really be? Can you tell us some of the benefits that you see?
Excellent question. There are two questions I often get. A, is this going to hurt my animal? And B, when they see what I do, is it enough?
Okay.
For all you skeptics out there, I thought the best thing to do was actually see a treatment in action.
How would you know if something was going on with your animal's back? And it's the same with the person. They'd have areas of heat, tenderness.
It kind of probably feels good. It almost looks like a little bit of a massage in a way, right?
In a way. I also do massage too, usually afterwards. But I'm moving this hip back and forth and trying to see, is there any resistance? Oh yeah, on this side he doesn't want to let that go. He's holding that back.
Interesting.
So I'm going to try this again. As I isolate that hip, there we go. There we go. And this might be a good stretch too at home.
Then Dr. Strickland pulled out this big needle-looking thing. I learned that it's actually called an activator gun.
I always show my instrument to the dogs. I'm going to impulse on every single spinal segment.
Can you do it like that?
Oh yes, He's saying, what is that? Oh, you see how as I impulse in, there are reactions?
Yes.
Now, you have to first get them used to the sound.
And then
as I do this is that involuntary reflex. And what we try to do is do at least 3 passes down the spine. And with each pass, we look to see if those reflexes decrease. My general rule of thumb is if I don't see any significant improvement in 2 or 3 visits, then 40 won't make a difference.
Okay. This is an amazing source of information for pet owners. I mean, some people, would say this is definite pampering for your pet. It is, but it's all about their wellness, isn't it?
Absolutely.
Well, I thank you so much. You've been a wealth of information today, and I know Presley thanks you.
For pet chiropractic in your area, visit avcadoctors.com.